Hello there, this is Dr. Lazar Jancic from Leederville Chiropractic Clinic. This month in June, I will be talking a lot about common conditions affecting the upper limb, meaning shoulder, elbows, and wrists and hands. This particular video is about good old tennis elbow. I think probably most people have heard of it. It affects the outside of the elbow through here. Can cause pain down from the elbow as well, even a little bit up, but is most characterized by pain, sometimes weakness, and irritation of the elbow. Now, most people are surprised to hear that it has often nothing to do with tennis. And in fact, 90% of the time, people have nothing to do with tennis, but you can still get tennis elbow. Tennis elbow just means lateral epicondylitis, which is inflammation on the outside of your elbow. Now, what causes that is typically repetitive movements. Now, with something like tennis elbow, usually there is an underlying level of irritation and inflammation there that's already present from typical repetitive movements that you do throughout the day. But what usually sets the pain off, that intense tennis elbow pain, is when you do something above and beyond your usual routine. So let's say you're an office worker and you do 8 hours of office work every day, but all of a sudden over the weekend you do, hours of gardening and you're clipping hedges or doing something repetitive, holding your hands, using your hands. Maybe you're helping someone move and you're carrying very heavy things. Of course, just by using your fingers and holding and gripping, you're activating the muscles in the forearm, which is what leads to tennis elbow. So this condition is usually an acute or a recent aggravation of an underlying chronic condition. But it's certainly characterized by a gradual buildup of inflammation and scar tissue around that spot in the elbow. So the way to improve this condition is to ideally isolate the repetitive activity. That's really important. I find that in itself can make a big difference to the pain and the progress and the prognosis of your condition. So isolating the exact repetitive movement that you are doing or did recently, that will help eliminate the cause of the pain. But however, you are still left with probably chronic inflammation and scar tissue in that area, and that's where some type of physical therapy will be very beneficial. So you can do a combination of stretching the forearm muscles. You can also have some chiropractic treatment where we can physically very gently break up some of the scar tissue that builds up around those joints in the elbows. And also often a program of strengthening those muscles. Because usually the reason that inflammation builds in the first place is because your muscles aren't coping with the level of demand that you're placing upon them. So by strengthening those muscles, you will help them cope better with the repetitive movements that you may not be able to avoid. So a combination of those three things is what significantly helps. It's also important to note with regards to tennis elbow that our upper limb is very closely and directly affected by the function of our spine, particularly the neck and the mid-back. So a lot of issues in the upper limb actually stem from problems in the spine itself. And as a chiropractor, when we assess a local problem like tennis elbow, it's very important to have kind of a holistic approach or an understanding of the entire mechanical system or kinetic chain which is involved and which often leads to these problems. So paying particular attention to the function and mobility in the neck and mid-back is an important component of resolving tennis elbow. I hope you found this interesting. If you have any questions or comments, please leave them below. And until next time, this is Dr. Lazar Jancic from Leederville Chiropractic Clinic.